Hello, everyone, and happy Wednesday. I'm Patricia Capella, Conference Manager with Clarion Events. Thank you so much for joining us today. We have an exciting, informative webcast series, Tribal Gaming in the New Normal with Victor Rocha. Today's discussion will focus on casino health, safety, and lessons learned during this pandemic. Before we introduce the presenters, I would like to go over some housekeeping notes. All audience members are in listen-only mode, which means you are muted. We will be monitoring audience engagement on the dashboard and do encourage you to participate by using the question pane. There will be time for questions at the end of the presentation, and we are recording this webinar, as you will receive an email with a copy of the recording tomorrow. This webinar, as well as others in our series, will also be made available on our website, indiangamingtradeshow.com, under the Education tab in the coming week. Now, without further delay, let me introduce Victor, our conference chairman with the National Indian Gaming Association and editor of Pachanga.net. Victor, it's all yours.
Thank you, Patty. How are you doing? Oh, 1 second. Let me get my notes. Good afternoon, Patty. Good afternoon, everyone. My name is Victor Rocha. My co-host, Jason Giles. We, like my conscience, will be popping in and out. Jason's the executive director of the National Gaming Association. And welcome. This is the new normal. In today's conversation, we're talking to our good friend, Ilko, safety manager for the casino, Sycuan Casino Resort, and the chairman of the National Indian Casino Safety and Security Association, and our dear friend, Andrew Hofstetter, who's with Tribal Government Affairs for BlueBird CPAs and one of the nicest guys in Indian country. We're going to be talking about what we're learning about trying to run a business during a pandemic. But before we dive into this conversation, let me give you some context. One of the great business minds of the 20th century, Mike Tyson, once said that everyone has a plan until you get punched in the face. And, you know, after 2.5 months, the tribes started reopening. You know, we've had these casinos open now for about 2.5 months. And, you know, everyone had the same goal of reopening the casinos and this safe environment for their employees, their customers, and tribal members. And, you know, but what have we learned in the last 2.5 months? You know, so we sent our intrepid friends, Eddie and Andrew, out in Indian country to find out what we've learned about health and safety in the workplace since we got punched in the face. And gentlemen, how are you doing?
Good, doing good.
Great. Thanks for having us.
Thank you.
There you are. There you are, Jason. How you doing, buddy?
Good, good.
So before we start, guys, crazy world we live in, right? So football is now being canceled. We had a couple college leagues opt out yesterday. We had the governor of Oklahoma continue his lawsuit against the tribes. That's happening. But in Indian country, you know, everyone is trying to get back to this new normal as we've been talking about. But what have we learned in the last 2.5 months? Eddie, let's start with you for a second. You know, you work with Sycuan, and how's things going over there? What have you guys learned in the last 2.5 months since you guys have been open?
So that's a great question, Victor, because back in February, you know, we were running our casino as we do regularly. Our safety program was in full gear, and then suddenly we got notice that in March we needed to close the casino, which we have never done. You know, Indian country has never closed their casinos, and Sycuan has been around for 37 years, and they had never had to close their doors. So luckily enough, we have just revamped our emergency action plan, because in order to close the casino down, I mean, you have to evacuate the personnel that are here. So we worked with our new management team and our safety committee to come up with a plan, and of course our gaming commission, to evacuate all of the guests that were here at the time on the day and time that we were going to close. And we did it kind of gradually, so it didn't affect too many people, because they knew beforehand what was going to happen. And
Are you talking about a soft closing? Is that what you had?
I think so. I think that in looking back, and it took, I'm not kidding you, once we got our team together in different areas of the casino to kind of walk and make sure people were eventually leaving the casino, it took us 7 minutes to evacuate everybody. So people were already knew that. So we had a really great plan in place, and that's something that I'm really proud of. And not only that, but our NICSSA association that you mentioned, we do a lot of networking with a lot of other tribal casinos. Right now we have about 50 members and about 450 individuals on our email list, and we go back and forth about these issues and things that they're seeing on the East Coast and in the Midwest and out here on the West Coast when it comes to closing all of our casinos, because no one had done it before. So this was totally new to everybody. So this was where the networking really, really took a hold, and people started sharing information with each other and started communicating more than ever before. You know, unfortunately, people did get furloughed, and there were people that was difficult getting a hold of. But once some people started coming back and we started, you know, kind of having a game plan from the upper management and from the tribal council. So everybody was on the same page, and we all had a meeting about this to discuss how it was going to look forward. How were we going to distribute, you know, the masks that people were now going to be required to wear? How are we going to enforce social distancing so people don't, you know, to get infected or separate each other enough to where the guidance that we were getting from the CDC, because those were the people that we were looking for, the professionals in the health and government agencies to tell us what were the proper protocols to put in place.
You know, Eddie, you mentioned your group, you know, so tell us a little more about this. I mean, was it like, you know, as soon as this happened, everyone is obviously on the front lines, and what kind of information were you guys sharing? Was it health and safety? Was it the CDC stuff? What were you guys doing?
Something that really helped out a lot was the NICSSA guidance on closing, because they had a guidance that I got from our good friend David Villapondo. He's now at Pokagon, executive director of the Gaming Commission, and he sent me their closing documents, and we were able to share it with all of our groups, NICSSA and the TGPN, and some of our also, you know, people that we've met at the NIGA conferences. And this document illustrates exactly what you needed to do to close down your casino, from the cash operations, you know, slots, how you were going to shut down your slot operations, which is most of what's on the casino floor, your table games operations, and also, and sometimes most importantly, is your facilities and maintenance. You know, because you have water. I mean, our tribes are not only self-governing, but they're self-maintained out here in a lot of these areas. So we had to look at a lot of our you know, wastewater treatment plants and things to make sure that things were still running, because we still had a very, very small crew that we needed to keep here. We had a small security crew, and they did an amazing job. I think we did more security inspections during that 2-month closure than we had done the previous year, because of the protocols we put in place to ensure safety. Because I had heard from other colleagues in the field that they'd have guests sometimes running through their casinos, you know, after they were closed. So, you know, we have.
Aren't you supposed to go room to room and make sure they're out of there? You know, are you sure they weren't ghosts? You know what I mean? There are ghosts. You know.
Yes. So,
by the way, ghosts are horrible customers. By the way, you know, they just yeah, the ROI is just really not worth it. You know. So we know you mentioned about closing. Were there any unexpected hurdles you encountered when closing? You know, it sounds like it would be like you said. You know, customers running around after you close. And imagine that would be a little jolting running around the corner. You know, but were there unexpected hurdles?
I think the unexpected hurdles were the fact that we had never done this before, and we were trying to figure out what would be the best process and how to do it properly without, you know, causing disruption to members, because they were, you know, as we were shutting down, they were getting furloughed, but yet still getting paid up to a certain time. And, you know, the Sycuan tribe is so generous, and they were, you know, paying us and giving us benefits throughout most of that time. I think they paid benefits up until July 31st, and we opened back up on May 20th. So, you know, the tribes have been super, super generous with their, you know, helping the team members out, because this is their livelihood, and thousands of employees across Indian country, you know, were furloughed and put in a position to have to go to unemployment. And now we're slowly coming back and seeing things like that coming back.
You know, that is the important part of this that we can't ever forget, because there is a real human element to all this, and it isn't just, well, we're going to close and we're going to do that. And there are, and I think we're very cognizant of that fact. And on another show, that's an issue that I do want to talk about. But Andrew, my friend, how are you doing, my brother?
Good. Thank you for having me. Appreciate it.
Well, thank you for coming. We really appreciate it. And I know Jason's really happy to have you, I can tell. And Andrew, what kind of issues were you seeing? One of the things that I thought was really interesting is that, you've seen a lot of people pivot. And I had this conversation yesterday where, when you're seeing a lot of people pivot in their jobs and their careers, when you can't do this, you're going to do that. And one of the things that I noticed is that there was a lot of people that are now in the PPE business. Did you find that also? I mean, can you tell us a little bit what about you're hearing? Eddie mentions the fact that you have to have masks and you have to have resources. What are you hearing out there?
Thank you. I had an opportunity to interview several tribes: the Seneca tribe, Coshada, Kickapoo traditional tribe of Texas, Seminole, Florida, and Pokagon. And what I'm finding when it comes to like PPEs, for example, in the beginning, it was difficult to get the supplies. Now tribes are able to get the supplies, but I'm also starting to hear that starting now, it's starting to become difficult in certain regions to get supplies, not only masks, but also the COVID-19 tests as well. Depending which region I'm speaking to, one region, they had no problem having all employees tested. And in other regions, they're having a difficulty getting a certain amount. So it seems to be different depending where we're looking. I have seen a variety of people just pop up like daisies out of the snow, and all of a sudden everyone's selling PPEs. But some of the learning lessons that I'm learning from people that have gone through vendors, if you will, that haven't been properly vetted is receiving the product on time and having that guarantee. So one of the lessons that reaching out to people is make sure you go through a reputable vendor or contractor when you're seeking out cleaning supplies or masks or whatever it may be.
That seems to be a big issue around the country, is that these masks, and from everything I've read, most of this equipment is not made in the United States, so it's all imported. You have to wait for that, and then not all of it is the certain type of quality that we expect. A lot of it doesn't reach the criteria, safety, health, and standards, and people have invested a lot of money in equipment they can't use. Is that what you're finding too, Andrew?
Yes. I'm finding that as
Now, you mentioned something yesterday about tribes buying in smaller batches to make sure that they're getting what they're buying. Instead of just buying $1 million worth of equipment, buy smaller batches and make sure that you're getting the right ones and stuff like that. Also, go ahead.
One thing, sorry to interrupt. There was one of the learning lessons when speaking to a variety of tribes. There was one, they just said, Andrew, the biggest lesson learned for us was seek out a sample first before you order 10,000 or 20,000, because they ran into it not fitting properly and not meeting their requirements to help protect themselves and the patrons. So I thought that was a very valid point, is to always seek out samples and make sure it's going to work for your property before you order a large supply.
Go ahead, Eddie.
Is before March, hardly anybody knew what a PPE was, right?
Yeah,
right.
Usually, if you're in the safety business or you have a facilities department, you're using PPE. You're using personal protective equipment like masks, because they're called N95s with respirators, and they're meant for work that you do. Let's say you have a paint shop, you have to wear this in order to filter the air. They're not meant to be worn by just average team members that are out on the casino floor, because you have to get fit tested per OSHA and ANSI standards. You have to get clearance from your doctor to make sure that you don't have any breathing problems, to make sure that you don't have any facial hair, so it fits properly. So this whole new era of PPE now being used by everybody, created a huge shortage in the supplies. So whatever you had on hand, everybody was grappling to try and find who you can get it from. Indian Health Services provided our clinic up here at Sycuan with a lot of these PPEs, and we were able to use some of those. But it's just really interesting how some of these products that were very strictly enforced and used for a particular purpose are now being used widely for purposes that they were not meant for. But we're getting better at using the ones that we do want people to put on.
Eddie, you mentioned something that's been very unique, and Andrew and I had this conversation the other day, which is, one of the things that the tribal casinos will make them different than commercial casinos is that because of the tribes, you do have usually a tribal health clinic on the reservation or near the reservation. How is that? How's that worked out for the tribes during that? Has that been advantageous to them? Has it been detrimental to them? What's Andrew? Let me throw this question to you. What are the relationships between the tribes and the health clinics? What have you been seeing out there?
Very favorable. One thing that I'm noticing, I want to use one tribe in particular, Coshada, as an example. When speaking with their general manager, one of the things I learned is they have their tribal clinic attached to their casino. And with that gives them a lot of ability to not only open communication, but also to have their doctors there as well. What I'm finding with most tribes is incorporating their tribal clinics and their doctors into their processes and review and recommendation processes. Some tribes, the clinic or the doctor, whoever may be in charge, is a part of the approval process of whether the casino should be open or closed or remain open, and dealing with a variety of different issues. And by having doctors on hand, on site, and having them so accessible really makes it easier for the operation to deal with a variety of challenges that may come up. So that's one of the things I found out.
Yeah, it just seems like common sense to me. Eddie, so when you guys were working with your clinic, how were you guys surprised? I mean, was it the tribe or was it the casino that suggested? How did you guys get to that process?
Well, our clinic over at our Sycuan Dental and Medical Clinic has a great relationship with Indian Health Services. We have a whole program that they were already implementing before the COVID even hit. So they were prepared. And through those relationships, they were able to fund their programs and keep them funded and kept with the resources that they were getting from certain suppliers.
Wow. And that really is one of the issues that differentiates the tribes between commercial gaming, is that the fact, besides being tribal government gaming and being taxed 100% to supply the government revenue, but it's also, you have the relationship with the Indian health clinics, which is, and as we all know, as Native Americans, a health clinic is like, that's one of those things you need to know, where your health, as you move into town, where's the local health clinic, on what reservation do I have to go? And so that's really a very important point. You gentlemen, can we talk a little bit about testing and tracing? Let's start with Eddie. Can you tell us about what your tribe has done with testing and tracing, and how important it is to your plan, your health and safety plan?
Sure, it's hugely important, and we put this plan in place before we even opened to ensure that it's so important to have the proper communication channels between departments in the casino and our HR department and our surveillance department in order to combine those efforts in order to reduce the opportunity for anyone that has tested positive to have come in contact with someone for a certain period of time. And what happens usually is someone will call in sick or call off, and we have a protocol they have to go through when that happens. So it's not that they're already here at the casino and sick. It's that they're calling in because we've told them if you have these certain symptoms, and we had a whole training with a PowerPoint with our HR department that they had every employee sign off on after they went through the training, that told them not only what the protocols, what questions were going to be asked of them. Are you feeling symptoms? Are you, feeling ill? Are you feeling that you have a cough? Do you have the fever, the chills? We have about a 6 questions that are asked, and once they answer yes, then they have to go through the protocol with our HR department, and they go through in order to come back to the casino, they have to get at least 2 negative tests in order to come back. So it's worked like that in many other places. We found that this new tracing ability takes a lot of time. Takes a lot of time from what your regular business would be. Takes a lot of time from our surveillance department. Takes a lot of resources to follow someone, to look at what the impact is between where this person was and where they were going and how much time they were spent there. Because it's not just about when you approach someone and if you're within 3 feet and you're speaking to someone with a mask, did you have prolonged exposure with that person for 10 to 15 minutes is what the guidance is from the CDC. So that's kind of how what we were using and what when talking to our NICSSA affiliates and members, what they were using as well.
Well, Eddie,
Yeah, go ahead, Jace.
Eddie, let me follow up on that. At NICSSA, we received a lot of reports from casino employees that did not like being tested every day. And we had some casinos that said, well, okay, we'll do it every 48 to 72 hours after that. And sure enough, some folks got sick. But how is Sycuan handling? Do you test every time they show up to work, or how is the testing protocol working at Sycuan for employees?
Here at this point, it's voluntary, and we recommend the testing. We opened up a Sycuan Square with a gas station and a convenience store there last year, and we set up in the parking lot in concert with the local San Diego County Health. We have testing there that's offered to our team members. So I've been tested there. I've gone a couple of times. You just go on a website and you can easily choose a place to go, and it's free. So it's a great program, and there's no reason why you wouldn't want to go get tested.
Wow, that sounds like, well, you know what, Jason, and that's the real issue. I mean, it costs a lot of money. It's very intrusive. People don't like to be, bugged, but it's something that we have to do. It's like this, it's, if we're going to stay open, if you want to do business during a pandemic, these are the minimal steps you have to take. Andrew, what are you hearing about testing and tracing? We had a really interesting conversation, and I'd like to follow up on that. What are you hearing about testing and tracing, and how is technology being used?
So I can answer that in certain parts. When talking to all the tribes, all of them had a tracking and tracing protocols in place, whether they were
Indians are really good at tracking, right?
Oh yeah.
Okay.
So
just letting you know, we're
good.
We're good. Yeah, thank you.
So with the tracing, I'm finding the tribes are having different teams put in place, but also something I learned from Pokagon, from Dave Villapondo, their executive director there at Pokagon, is they have a certification. If you're going to get involved, especially the Gaming Commission, with tracing and tracking, you have to go through the certification program that's free. It's offered by Johns Hopkins University. And that was something that I learned. One is an introductory, the very first one you have to take. And then the second, so it educates you, what is tracing? How do you do it? What are the steps? What are the protocols that you should follow to maintain a safe environment? And then the second class is more advanced, where you're testing what you just checked, just to make sure it's good and it's sound and it's safe. And that class is much harder. I'm getting ready to take the classes myself here shortly. I don't know. I really wanted to share that piece because that was something I didn't know that was available to tribes, and it's free. So I would really encourage that.
The other day, I forgot the governor, but I believe it was Ohio, where Trump went to Ohio, and then the governor tested positive, and then the same day he tested negative. You know what I mean? And that seems to be a real big issue with false positives and stuff like that. One of the things that we talked about the other day, which I thought was really fascinating, was you talked about how tribes are using their players club for testing and tracing too. Can you tell me a little more about that? What are you hearing about that, Andrew?
So I've noticed that there's one tribe in particular, I can't think of the name at the moment, but utilizing Players Club and tracking. When you think of Players Club, we think of points and different things, the personal information, but they've added new categories to where they can put tracing in there, and where that can all be tracked on a database and also an app that goes to management's phone. And what I'm finding, speaking of apps, what I'm also finding is a variety of tribes are involving different people to make apps for themselves to track, maintain temperatures, maintain records and statistics. When we look at Seneca, I was very impressed their use of statistics and using apps, not only on a tribal level, community level, state level, but on a federal level as well. And they also track through different spreadsheets and apps what's happening in America that may be violent. So Black Lives Matter, with the different riots and things going on, that all factors in at the same time with COVID-19 as a serious factor that could warrant a shutdown if it was in its immediate area. And they're open now. However, they already established their protocols if they have to close again, and what are the triggers that they have to reach, what warrants a shutdown, whether it's COVID-19 or riot or whatever it may be. So it was very interesting to look at all of the effort that was put into creating these different programs. And the one that impressed me the most was there's always new information coming out daily. So was having an app for the staff. They can watch it on their computer or their phone or their tablet, and it shows them the latest videos and updates, and it actually demonstrates how to clean properly. And they have to complete these videos and sign off on them before they can work, which I thought was very interesting, bringing technology to your fingertips.
It just seems like so obvious that tribes would be doing it, but everyone has their own level of getting to that same place. But it really does bring up the question of privacy and security, and I know that's a big issue with our customers and with our employees, and that's that balance that we have to have safety of our customers and our employees, to balance it with security and checking. And that's why I think
Victor, let me ask Eddie about that. Has Sycuan encountered the patron yet that refuses to wear a mask or abide by the safety conditions set by Sycuan? Have you encountered those folks yet?
Oh yes, let me talk to you about that, because that is a huge program that we have right now. So right when the cases started going up recently, about a month ago here in California, we were about to open our bingo and poker departments. We had put in the plexiglass to separate the guests, and the tribe decided not to with upper management. And we had bingo employees that were already back to work, ready for the opening. So what our GM, Rob Sinelli, who's been here since December, said, you know what, why don't we put these bingo team members to work under Eddie and make them mask enforcers? So I thought about it, we made a job description, and we called them safety agents. So I've had 22 bingo team members. Remember, they are not safety people. They are coming from bingo, and bingo is a very kind of niche area, because there's a repeat business, and it's really how Sycuan got started in their bingo hall back in 1983. So when I got the safety agents, I had to train them on the protocols on what to do and how to approach the guests who didn't want to wear a mask, who were wearing them. I have this one right here, and I'll shamelessly plug my San Diego Padres because they're in first place right now. But we encounter people wearing in like this. They're sitting at a slot machine, and That's not the proper way to wear a mask. So we ask them to probably put it over their nose or their heads down like this because they're smoking. Is another issue, right? What are you going to do about smokers? How are they going to be able to wear a mask while they smoke? They can't, right? So we have pulled back the lever on allowing smoking in a lot of areas. Now, what we have right now is a guest can only smoke when they're seated at a slot machine or when they're at a bar. They can't smoke while they're walking through the casino going from A to B. So it's been a learning experience for a lot of guests as well. We've had pushback. I won't lie to you, it's very infrequent because some people just don't want to wear it. As you can see over here over my shoulder, we are implementing some new protocols this week because we found out through the Mayo Clinic and through some studies that the masks that have the filters don't filter the air that's coming out, only the air that's coming in. So we decided and management approved those. Also, bandanas are not allowed because the bandanas that people wear, they wear them like this, and then they have an open area underneath that air can escape and your breath can escape. So we're not allowing those either, or those gaiters. The ones you wear around your neck, you can just pull up easily because they're so thin. And there was a study yesterday that by Duke University that came out that it's worse than having than not wearing a mask because it halts the droplets closer to the person you're talking to, or it doesn't go as far. So because of those issues, our safety agents have done an amazing job, and they transitioned really, really well. And we've done it with our team members as well because our employees have to wear masks as well. And they've been complying and helping out because we can't just do it with the 22 safety agents. It's everybody's responsibility. We had a program right before we launched the safety agents called the Safety Committee Call to Action, where all of our employees from our safety committee on every shift on certain hours would hit the casino floor and remind guests to wear your mask properly and engage in conversation with them, because this is where we're about customer service in the end, right? This is what we push here, even our security department, right? We're 90% customer service, 10% security. So we remember that, and it's going well. Although I can't refute what you're saying, Jason. We have had pushback, but it's been very minimal, and we have to, in a sense, train our guests. So when they come back, because they're repeat customers, most of our guests, right? They're in the local area, they come all the time, and they know what our protocols are. But we have had guests trying to get away with not wearing one by just holding up a cigarette as you want to approach them, or holding up a drink. Right? But because sometimes if they're at a slot machine and they have a drink in front of them, but they're not actively drinking, should they be wearing a mask? Right? It's these nuances too that get in the way sometimes. So, and also with our drink servers, right? We want to be able to make sure that the drink servers are following protocol, and if a guest isn't wearing a mask, they should put it on before ordering a drink, right? And you have to take into account the servers are also, their income is based on tips, so you don't want to make the guest upset either. So it's a balancing, and we do a great job with our food and beverage department on training our employees. John Foster, our director of food and beverage, came to talk to us about these issues last week, and we put on, we enhanced the program that we already had to put in place because of what we've seen happening out on the casino floor and at the bars.
Well, first of all, yeah, go ahead. First of all, I think the last time I went to bingo over at Pechanga, I was harassed by a bunch of vicious elders. So I'm sure that, the bingo employees are used to dealing with, obstinate customers and stuff like that too, because it's pretty vicious up there, as you know. I stood up and spoke too loud, and I was almost beat down by some mean elders, man. They were tough. So, and you bring up an interesting question, and Andrew, I'd like this one to go to you. Eddie talked about what are you seeing about social distancing on the floor? Because that's what you're seeing. People are on the floor. You do have social distancing, and what Eddie said, that just happened a week ago at Seminoles and Hard Rock. On like Friday night, there was an expose in the Sun Sentinel of videos of people walking around drinking and smoking, and the very next day they announced the policy that you have to be stationary if you're going to be doing it. And that's the compromise that the tribes are trying to fine line that we're trying to walk, trying to provide customer service and yet trying to keep people safe. What are you seeing, Andrew, with social distancing on the floor and stuff like that? What are you seeing? What are the modifications?
Real quick, Chairman Stevens texted. He wanted to tell everyone hello, and he wanted to let everyone know that he's listening in. So I wanted to do a shout out for Chairman Stevens. To answer your question, I've seen quite a bit with social distancing. One of the many lessons learned while I interviewed tribes across the country is the use of utilizing their full footprint of their property to move their machines further apart, and also their table games further apart, and not just table games and slot machines, but also food and beverage as well. Most buffets are shut down, and they're utilizing the buffet space for cafe space to make it where you're 6 feet to 10 feet apart. 6 feet is the common regulation. However, some tribes have gone above and beyond to 10 and 12 feet apart, which I thought was interesting. And not only are they, let's use table games and slot machines, for example, not only are they spacing out the machines or removing a slot machine in between in the middle, but they're also incorporating the plexiglass as well. Table games, slot machines, the cages, players club, anywhere where you have that close contact where you have to make an exchange of tickets or money or chips and that kind of thing. And I thought that's the common trend that we're seeing out of all the tribes that I interviewed. They all had that in common, was that social distancing. And I just wanted to make a comment real quick. One of the learning lessons, Eddie was talking about masks on the last topic. One of the biggest learning lessons is when we're wearing these masks, so the N95, did I say that properly, Eddie? Is that what it's called? They're really hard to breathe through just having a conversation. But something came up the other day was a tribe was having a problem with the drop team. The drop team function is very extraneous. It's very involved. You're moving boxes, you're taking boxes, you're going back and forth. So now they're having to incorporate breaks and changing their course of direction to allow for more space, more breaks, and more movement, which it makes sense that, when you have a strenuous job, you have to take these other factors into place for taking breaks and keeping everyone safe.
Andrew,
go ahead. Go ahead, Jason.
Where you're in New Mexico right now, Andrew?
No, I'm in Southern California over by Cibola.
Okay. I just, because have you seen or heard anything about the efficacy of these ultraviolet lights and stuff? I've saw, like Wynn and them said they were going to put their chips under these lights and stuff to disinfect them that way. Has there been any efficacy studies on that? Because I kind of feel like the whole touching the surface and all that, we've had a doctor from Johns Hopkins, she said that concern is way down on the priority list now, that it's definitely the particulates and everything, not necessarily the touching. Although, if somebody breathed on a doorknob and you touched it right after, obviously. But what do you know about those cleaning the chips in that manner?
So that's a very interesting topic. Anytime we come in contact with money, chips, or whatever, they have to be cleaned. I have heard about the different lights, using lights to clean. Now I haven't experienced it personally, and I haven't seen it personally, but the different reports that I'm getting from different people is it doesn't work as well or at all. But you need the traditional cleaners where you're actually spraying on or wiping on. Having cleaning processes, now that table games is back open, for example, we're not only did they traditionally clean them, but now they need to clean them more frequently, and they need to be more thorough. They just can't be a slight wipe down. You actually have to take each chip and take the time to do both sides and also the edges as well. There have been a variety of learning lessons from tribes as they made a policy. Let's say it's cleaning chips with these two cleaners, whatever they are, and they have it in place and they think everything's fine. The lesson that they learned is you have to spot audit and double check and observe how they're cleaning after they've been trained to make sure they're following the cleaning process. And that's something that tribes are really getting involved in checking to make sure that they are following the processes that were implemented, because you do have those occasional people that will try to skip a process to get through it cleaner or to open their table quicker or whatever. But I looked for white papers on the lights because I have heard about that. And I heard about them using lights on IDs and money, but I haven't really seen any favorable statistics or results that would really warrant or suggest a tribe utilizing those lights. But I mean, I could always be proven wrong, but the traditional the cleaners are really common. And also one tribe is using, can't remember the name of the filter, but it has a high accuracy rate for killing viruses. And I believe they're using that in Florida and also some other states as well. And that's some new technology I just recently learned about this week. And then there's also the microbial, not sure if I'm saying that correctly. I'm sure I'll get corrected later, but there's the microbial sprays as well.
Not for me.
The sprays that are supposed to be long lasting. You should clean every day, but for whatever chance, let's say you forgot to wipe a counter and it was sprayed with this particular microbial, the claim is that it keeps continuing to kill even after 24 or 72 hours.
Well, hey, Eddie, kind of the same question. What are you experiencing with social distancing on your floor, and how you guys are dealing with that?
Yeah, so we, have, of course, the infamous stickers that you see on the floors now that ask you when you're standing in a line, be it at the bar, be it in a restaurant, queuing in to get in. When now we have a dance floor because we have a band that plays on the weekends behind plexiglass. We have a guitar, another person singing. And they're behind plexiglass, and in the front of the stage, we have stickers that say where they need to stand to dance. The dancing stickers.
So is this like the Fred Murray school of the dance steps, the feet on the floor where they move around, so the social distancing type of thing? Excellent.
Absolutely.
I like that. I like that idea.
Victor, they needed Eddie at Sturgis for the Smash Mouth concert yesterday.
Aye. Well, you know what, Eddie, and that's a whole other issue about entertainment, and it's an issue we're going to be covering in the next couple of weeks. But that's kind of how I imagined it. The bands are going to be behind plexiglass and stuff like that. But so we got a question from one of our listeners, and one of our and it's a very good question. It has to do with your sign in the back, Eddie. What do you guys do when you have customers that have the incorrect face masks? Do you guys give them face masks? Do you send them home? What do you do?
Yeah, we're definitely not sending them home. We are have now a supply of masks where we offer them. If they bring in the wrong one, we can offer them one. We also sell them in our gift shop as well. So our safety agents, they carry with them, and they have these pouches they got from our wardrobe department. They carry some masks with them. They carry hand sanitizer. They carry
breath mints.
Oh, that's a good idea. We might add that, but it might get into the beverage.
Well, you know what? I saw an article over the weekend, and they're talking about. They said, the rule of thumb when you're in conversation with someone, they called it the garlic breath test. That if you can smell someone's garlic breath, you're too close, and that's actually true. So they said, if you can smell somebody's breath, you're way too close. Which is, I've always felt that was too close to begin with, but it's nice to know that I have, so that's kind of interesting, the garlic breath tests out there too. But so you do have masks, and you are giving them out, which I think is really important. Andrew, I have a question for you also. Let me get my thing. I apologize. Andrew, has anyone started their shuttle services safely yet? That's a good question.
So shuttle services, there are some that I have seen that are being shut down along with valet as well, and utilizing those staff in other areas. And that might be a good example, utilizing those staff like what Eddie called safety agents. Is that what you called them? And utilizing those staff in other areas to help, just make sure that people have their masks on. I haven't seen any that are utilizing the shuttles anymore. That was one of the common shutdowns, along with poker and also the buffet and valet as well, which I'm starting to see as a common trend. And also no smoking. I'm starting to see that pop up more and more, and also moving alcohol away from the gaming floor and into the restaurants.
But well, guys, go ahead, Jason.
Yeah, Eddie, along those same lines, I'm not going to put you on the spot for proprietary information or anything like that, but the commercial gaming industry is required to, report their second quarter filings, and it was pretty bleak. They were down 80, 90%. They reported hotel occupancies of 20% during the weekday, 30% on the weekends. Pretty bleak numbers, if you ask me, after an initial surge, I suppose, when they reopened. What is Sycuan seeing just generally on your customer and patron, attendance and walkthrough? Are you seeing good business?
Actually, we are, and it's a result of the new management team that we have, but we also implemented the 50 to 60% occupancy. And at every entrance of the casino, we have a laptop, like a Microsoft tablet, where we have a counter that our IT department hooked us up with, so we can count how many people come in, and then if people are leaving, there's a minus button for how many people leave the casino. So we have a certain number in mind, and our casino shift managers, the CSM, are in control of that number. On certain nights when it gets too busy, we'll have them wait in line, but mostly it's been pretty good, I have to tell you. We've seen a definite level of participation here and visits to the casino.
Victor,
go ahead, Jason.
Victor, that speaks to what we've all, the strength of Indian gaming is our customer base. We're not reliant on thousands of flights a day to bring our customer base in. It's much more of a local and a community relationship, and Sycuan is doing a fantastic job fostering that, and I hope other casinos recognize that they're actually in a strong position to keep the locals, the folks that drive there, are the regulars, and we're in a stronger position than commercial gaming to come out of this on the other side with our feet standing.
And we really have to tell you, I mean, the quality of safety. We have a video that we show on our website that shows this TrueClean product that came and did a whole spray of the casino and all of the surfaces of the casino and all of the shuttles and all of our buses and all of its office areas. And we have people out on the casino floor cleaning with a product called QT3, which they get trained on, and they're wiping it down because it kills the coronavirus, and they're wiping down chairs and slot machines and the table games and bars and stools. I mean, it is a complete team effort here. I mean, if you see them now, our EVS team, our environmental services team, are out on the casino floor in these bright green shirts that says Sycuan Cares on it, and they're out there because sometimes the guest will require some service or whatever it is, but they see them out there. They're more noticeable too.
So, gentlemen, the purpose of today's conversation is really, to help people understand that, we are constantly changing. We are constantly, readjusting our plans as they change, like you see with your masks and stuff like that behind her. And so it seems like, the tribes, the way it is, like Jason says, it plays back into the strength, which is a locals game. Over the weekend, I read an analysis report from a report from an analyst, I should say, and they were talking about Vegas is now no longer in the gaming industry; they're in the gambling industry, and I kind of think that's kind of where we're all back into, which is we're all back to the basics. You know what I mean? Gambling, customer, and taking care of your customers is like the number one thing, and giving them a safe environment. And that's what we're doing. So, so in the last 2.5 months, and I'm going to start with you, Eddie, and then let me go with you, Andrew. So in the last 2.5 months, how do you feel the tribes have been doing? Do you feel, has it been a lot of change when you first started, your mindset? What has changed now 2.5, almost 3 months later? How has that changed? In the beginning, I'm sure you were very apprehensive and nervous, and, what has changed in the last 3 months for you guys?
Yeah, because in the beginning, when we reopened, it was really, a process of getting everything back up and getting the personnel back to the casino to be able to properly, have the proper guest service that we need. And Not every location here at the casino opened. Some of our restaurants didn't open, and it was a progressive kind of opening. As you know, we did every other slot machine, and we only allowed 3 people per table game to be betting at, you know, our blackjack tables and so on. So it was a training of not only the guests but the staff, because it was just it wasn't normal to have social distancing. It wasn't normal to wear masks. So the beginning was difficult. It was difficult for everybody because different people have different needs, and you know, people don't react the same way to when you're telling them to do something. So it was almost when you're opening and you're enforcing a new rule that people don't want to follow, you know, how do you turn that around and make it a positive experience? So we've come such a long way in just a short 2.5 months, which is why these safety agents were such a blessing to have them out there, because a lot of the bingo guests now were here playing slot machines, and they knew the bingo team members. So they had already had a built-in relationship with them. And that's what made Sycuan so great and such a leader in the industry, not only in you know, gaming, but our safety department has come a huge long way as well.
Yeah, and how are your customers? You know, your best customers, your family. How are they dealing with the changes?
They're adapting really well. You know, we have a lot of new amenities because we opened a new hotel. We recently had a 1-year anniversary. Unfortunately, it was right after we closed. But yeah, they have been come back and they've been really, you know, positive. You know, we react to some of the comments that people make in order to get better, like any business does, you know, in order to provide the best guest service that we can. Because as safety manager and claims manager here in my office, I deal with a lot of, you know, complaints, and I deal with a lot, not, you know, a lot, but a good share of issues that guests have, and I resolve it for them. And some need a little tweaking, which we do. You know, it's a very kind of fluid situation right now that we're encountering. And right now it's been really good. It's been really steady. And I'm glad to say that, you know, our leaders here, our upper management, our executive team are working day and night. I mean, they work on weekends, they take calls at all times of the day in order to address issues that come up, so we can keep, you know, the team members and the guests safe, because this is the tribe's livelihood here that we're talking about. And we have to keep this casino open in order to provide for the tribal members and for Indian country and for their livelihood. So that's on the top priority. That's on the top of the list, I can tell you that. At every meeting I go to, safety and how we're doing in order to keep everybody safe here.
Wonderful. And by the way, Eddie, you guys do have a beautiful facility, and you know, I think it's one of the most beautiful casinos in Southern California. So congratulations, and I know you guys are just doing a wonderful job. Andrew, my brother, my dear friend. So, you know, what do you think are the trends? What are we going to be seeing in the next 6 months? You know, testing the show. And actually, before we start, someone had a question for you. They wanted to know were the name of the filters MERVs? Is that what they're called? MERVS?
I've heard that term. If everybody, I can look it up and get back to them. I'm not sure how I would relay that, maybe through yourself, but I can look up that filter, and also the not sure if I'm saying this right, the microbial spray as well.
That sounds good to me, man. That's perfect, actually.
I can get that. I'll send that to you, Victor, and then wherever that goes, just wave your eagle feathers over it and make it so.
Wow. Yeah. Are there any eagle feather type of filtration systems or anything like that? Any native? Nobody's looking into that, huh? All right. I'll invent it. Let me invent that. So Andrew, you know, what do you see the trend? You know, when you reached out and you were talking to all the tribes and our dear friend Dave Villapondo with the Pagans and stuff, you know, what are you hearing, and what can you predict the future a little bit for me? I know it's a lot, but go ahead.
So with this pandemic that happened in 2020, it has drastically shaped Indian gaming as we know it, and it's also shaped our personal lives as we know it as well. As we go to Walmart and the mall, we're having to use masks, and we use wipes in the car when we leave whatever area we're at. But when we apply that to Indian gaming is very unique because tribes are very family-like. They're all about protecting the guests. If you come in and you're gambling or come in for a meal or whatever it may be, you're their guest, and it's their priority to protect you, protect the staff, to protect the tribes, and also ultimately protect the future generations. So what I'm seeing a lot of that's going to already happening is moving to touchless programs. So have you ever heard of tap on the credit card and tap on the ATM? I'm starting to see them utilize tap. I'm starting to see other touchless programs where you just wave your hand over it, whether if it's an ATM or a vending machine or whatever it may be, where you can also, let's say you're buying a meal, but you can transfer it without touching. So a lot of touchless systems I predict in the future. I predict more, I've never seen more cleaning videos and videos on educating not only on PPEs and wearing them properly. It's amazing. I only thought it was in Hemet where people wore their masks wrong, but I went into San Diego and I realized it happens there too. So I see more training videos. I see more apps on the phone. Most people have these smartphones. So I predict more apps that are being used, more Zoom calls for communication, and it's really changing how we do business, whether internally or externally. And I really feel that tribes are going to be educating the public because they may not receive it when they go to Costco or Walmart or Burger King or wherever, but I really feel that tribes are going to be educating the public on how to be safe. And these are the measures, and this is how it keeps you and your family safe. So I predict that. And also policies, changes in policies. One of the biggest lessons learned with COVID-19, I almost forgot to mention this, was let's say you're going to install plexiglass at your slot machines. A common thing that I've heard come up many times is when you go to open the door, the slot department isn't exactly communicating with the department that's installing the plexiglass. You really need to test if you're going to buy something or put something in. Have the appropriate people there test it before you mount it. Otherwise, it can be an embarrassing situation when it comes to the drop team comes through and they can't get it out. Plexiglass. So a lot of learning lessons I foresee in this 6-month period. This last 3 months, tribes, in my personal opinion, I might get struck by lightning for this, but I see tribes are really above and beyond a lot of state standards that are happening out there in America in a variety of different states. So I really applaud Indian country for all their efforts, training, policies, their attention to detail, their attention to testing, getting certification, educating everyone before you start work, and then having a process that addresses a variety of issues and concerns.
You know, Andrew, thing to remember too is just because a person has a smartphone doesn't make them smart. You know, I think we've all learned that. You know, and one more thing, and this kind of goes to what Eddie said too. I think the other thing we're going to see is, and you're seeing it already, is a more push towards cashless technology. You know, more cashless and stuff like that. You're seeing it in stores. You know, I don't even have cash in my wallet since the pandemic and stuff like that. And when I do have cash, I feel like you pull it, you reach for your wallet, you might as well reach for a gun to someone. They're like, well, you're gonna put that filthy lucre on my table? You know what I mean? So, you know, guys, thank you so much. We're at the end of our program. We want to thank you very much. Jason, next week we have a really great program. We're going to be talking about A World Without Sports with AC Green and Christopher Spacek from the Hard Rock, talking about the world of sports and what that means to our bottom lines. And it's going to be a really interesting. Perfect. Yeah, brother. It's going to be a good one. Gentlemen, thank you very much. I really appreciate this. Was a fascinating conversation. And I think, you know, the big takeaway is here is that, you know, the important thing is that, you know, we still have to adapt and everything is still changing. And, you know, if we're going to stay open during the pandemic, that's what we have to do. So thank you very, very much, gentlemen. Eddie, Andrew, my two dear friends. Jason, thank you again for a wonderful show. And Patty, thank you, Patty, for another great show. We have her for another week, and our dear friend Patty is leaving. So next week, we're going to be talking about A World Without Sports and Tribal Gaming. So thank you very much. We'll see you guys next week. Thanks. Bye.
Thank you, guys.
Thank you, guys.